to all of you. Myself, Dr. Aarti Motwani. I warmly welcome all of you to our today's session, Art of Decoding the Pathological Cases Part 3. I must say, and I highly appreciate that in the first part, we got the participants from the 4 countries, 7 states, and 55 cities, which nearly jumped double in the part 2 session of the same Art of Decoding, which was nearly 8 countries, 12 states, and 60 cities. And today, in the part 3, we have really got an overwhelming response from all of you. And we are very grateful to have such a disciplined and dedicated group of homeopaths. It's a family to us. I thank you, all of you, being part of us, being with us. And without taking much time, as Dr. Pravin himself has said that he is very much keen about the pathological cases. And it's a kick for him to treat a challenging cases, where he used all the basic classical knowledge to the advanced knowledge of the homeopathy and the pathological side of the case. Let's learn from him. Let's learn and grow together, and hand over to Dr. Pravin.
Yes, thank you so much, Dr. Aarti, one of the dynamic our team member, and I would also like to welcome Dr. Naim Lisa from Karnataka. Welcome, ma'am. And no doubt, since last 15 years, I would love to share my knowledge with anyone. It's not about to hide anything from my side, and I have a mission. It's not like you can say our team Koshi have a mission that learn together and grow together. Definitely, sharing is one of the most important part of any person in his life. If we share our knowledge, it will definitely grow, helps us to grow. So we are going to start a session, right? IT, we have to mute everyone, so do not disturb us. There? Yeah, so keep them all. Okay, fine. So welcome you all again. May I see my face? I'm not able to see my face.
Yes, doctor.
Yeah. Fine. So welcome you all again, our free webinar part 3 on art of decoding pathological cases in homeopathy. So one of my colleagues asked me, dear Pravin, the March month is for all about the women's day and all that, PCODs and blah, blah, blah. I said, it's okay, man. It's definitely a women's day and women's month, and people are sharing their own knowledge on PCODs, and menses and all that. But I thought, why not we come with a very basic and important topic of today's era, that homeopathy can also does well in any kind of pathological cases. And I feel I was like seeking for someone who can teach me how to enter into pathological cases. I was seeking to get a master, to get a mentor, to get a guru for me who's completely, working in pathological cases. No doubt, it's there in Calcutta, but I tried to learn from that angle also, to go with one-line symptoms, to go with the Boric, to go with the Allen Skinner, to go with the Fata Mathematica, to go with the many repertories, but just going with a single line or going with a single symptoms to enter into the case, it was really difficult for me, because I belong to a classical homeopathy practitioners, and I just belong to a classical homeopathy background. So I decided, why not do something, simplify? Why not do something very simple, that a student from first year and a doctor, senior most doctor from 71 years can also understand the knowledge, understand the process, how we enter the pathological case. So that's why I collected all this knowledge. That's why I come to the few codings from which we enter the case, from which we can decode the case, right? So today I would love to welcome you all, and as you know that I always love to share some few quotes, because that few quotes gives us a best learning in our life, and we remember it again and again, and it helps us to boost ourselves in our clinical practice. So what Dr. Albert Einstein said, when we stop learning, we stop growing. I'm going to read it again. When we stop learning, we stop growing. So late, humble, be teachable, and always keep learning from everyone. This is one of the most important point. The quote I always used to read it, and I always feel that still I am a student. I love to learn from everyone, and that is the key of success. I think so, because homeopathy is just a vast knowledge where the learning process is going on at the end of life, right? So I just wanted to revise again what we have learned in past two free webinars. So past two webinars, we learned about a case of burn ulcer, and in first webinar we also learned a case of unhealed ulcer. Then we have seen about the significance of diagnosis, why diagnosis is important while dealing with the pathological case, how we entered the repertory or rubrics through the diagnosis. We have seen that. Then significance of one of the most important part of my practice is clinical examination. It's not never written anywhere that homeopath should not go for clinical examination. Every homeopath, wherever he is, in Canada, in US, in Croatia, you must need to examine your patient. Okay, it definitely will help you out to understand the pain, to understand the diagnosis. Then the significance of investigations and the observation, it definitely going to help you out in prognosis that your remedy is acting well or not. Is there any aggravation or not? This helps. Then there are different types of approaches while dealing with pathological disease. We can say a disease specific approach, organo-specific approach, there are pathological approach, there are a sensation approach, there are so many approaches from which we can enter the pathological case and else to get the cure. In last webinar, last Sunday, we have seen that what is the importance of state simile, right? So into these, there are so many important points, there are so many important codes we learned. For this is all for the people who are joining first time. In the first webinar, we have seen the importance of etiology, causative factor, why cause is important, as we know that every allopath or whenever used to go for any ICU or in a clinical practice of allopath, they always write down etiology behind the disease, etiology behind the diagnosis, etiology behind the complaint. So as per the etiology, we have different rubrics. From there we can enter the case. I always share this to my young buddies, first to final years, the interns students. At least if you don't know anything in the case, at least you can take the modalities. At least the modalities. From the modality, at least you can get the hint of a group of remedies. You can get the a hint to enter the case. And most of the chief complaint of pathological cases, modality plays the most important role, most crucial role to enter the case. We have seen it in last two cases where there is a burning pain. What was the character of burning pain and what was the modality, right? So in acute case or in pathological case or in ICU cases, modality is one of the most important part to enter the case. Now, in second webinar, we have seen the last part, that the state simillimum. This is nothing but the current mental state of the patient in pathological state. The current mental state of the patient in the pathological disease, in current state. Whenever there is a pain, he is a stupor, he's into the moaning, he is shouting, he is taking his tongue out continuously, he is just opening his eyes half openly, we can call it a vigil coma. So you have to understand, during this pathology or during this gangrene, he is completely in anxiety, he is completely in fear, he is completely in agony. So it's just not that in pathology you cannot consider the mental, you must need to consider the mental, right? And all these things, all these codes is going to help you out to make a totality, right? So this is one of the most important point. So some people ask me, doctor, what is there into the state simillimum? Into the state simillimum, we have to consider everything. We have to consider diagnosis, we have to consider modality, we have to consider etiology, mental symptoms, some PQRS, some factual things which is there. Also consider the observation. All these things are important, right? And today, in this session, we are going to learn about a case of herpes infection, right? Herpes is a kind of a pathology. Herpes is a kind of acute condition in any homeopathic practitioners they came across in their entire life, right? you have to deal with herpes, because the patient can come to you after the herpes, post-herpetic eruptions or post-herpetic neuralgia, or they can come at the early stage of herpes. So in today's session, we are going to learn about a very simple case of herpes infection, then how to deal with this kind of emergencies, how to take an instant repatriation, where to look into the case. Okay. Again, what is the significance of observation while dealing with the case? While taking the rubrics, this is very important. How to find the sensation in pathological case? This is one of the toughest part, no? How to find out the sensation? No, if somebody can ask, doctor, sensation in pathology, how is it possible? No, but is it possible? First 10 minutes is very, very important. If you are going to investigate your chief complaint for first 10 minutes, you can get the clue of sensation. And after exploring the pain or after exploring the sensation, you can get the kingdom, you can get the family, you can get the subfamily, you can get the row, or you can get the column, you can get the element, you can get the exact ophidia or exact plant remedy. Right? Why I'm telling you, why I'm teaching you these things? Because it's there in the case, and it's really helpful to give the result in a very accurate way, very precise way. And at the end of this today's session or today's case, we have a very beautiful case by one of my best friend, Dr. Manish Yadav, and he's going to talk to you about just for 10 minutes regarding his case and what is the importance of decoding pathological cases. He's going to tell us. Okay, and I would love to, I would love to share with that this case is really near to my heart, because I have shared this case with my guru, my sir, my Dr. Shankaran sir. I have already presented this case in person with him at APTI in 2018. And during that session, it was really amazing session for me, because I have never seen that sir can be so listener, so good listener for his students also. He was there in my case. He was there in my session. It was just half an hour session, and he listened me so carefully. He makes me, he creates. He asked me a few questions. He asked me a few queries about it, and it was very difficult for me to give answer for it. But I dared to talk in front of you, and it was really a great day for me. And today I am going to share the same case with you all, and definitely no doubt we need to learn from all the mentors, we need to learn from all the gurus, we need to learn from everyone, and we have to develop our own knowledge. We have to develop our own process of healing. We have to develop our own process of giving the cure to the patient, right? We have to heal humanity like this way. So let's start our today's case. This is a case of herpes infection, and this is the third webinar, and almost there are few people who already there in my last two sessions. So I hope they could solve this case. They can solve this case and they can come to the remedy. So are you ready, my dear friends, to solve the case? Let's go. So this is a case of herpes infection, and you can see in the picture these herpes patches or eruptions on the buttocks. Okay, it was on both the sides. It's a small girl of 8 years, and now you can see it was a case. They came to me on 20th of July 2017, and she was just supposed to go to the school. She was in uniform, and they came to me in my clinic, and it was the picture. Now you can see on the right side there was much more eruptions, much more patchy kind of eruptions of herpes simplex, and on left side also there are few eruptions, right? So what is the interesting point of this case? Basically, I was practicing in village level. I am practicing at taluka level, and many students ask me, doctor, why are you sharing so many cases? Why you are sharing so many cases? Why you are not come to the point directly? But my dear friends, what I think so, the cases is the only point which helps us to understand so many things just in a single case. It helps us to understand diagnosis. It helps us to understand a practical approach. It helps us to understand rubrics, mater medica, remedies, from which point or from which anchor we enter the case. There are so many things to understand: the pathophysiology behind description, pathophysiology of that remedy, Here we can understand the etiology, the diagnosis. So that's why I love just sharing the cases, right? So just talking so many points on theory or just talking so many points on, on just PPT, I feel more happy to share my cases. I feel happy to share my, my understandings, my experience, my practical experience of the cases. That's why I'm here to share the cases, right? So that's why I always love to share my case. So in this case, what is the beauty? I'm practicing at village level. So one of the doctor is an MD medicine, and he referred the case to me. Yeah. On this prescription pad, he already wrote that there is a herpes infection. So it's a herpes infection. I said, okay, tell me something about it. So her mother told me, doctor, my daughter developed these patches and eruptions on the buttocks since last 2 to 4 days. I said, okay, tell me. And she was completely crying all the time, doctor, because of severe burning pain. And she's not able to move, she's not able to sleep, she's not able to, walk properly because there is severe burning pain. I said, okay, tell me something. So her mother told, doctor, I was supposed to go her school, and while changing her clothes, I noticed that the herpetic eruptions or that the patchy eruptions was increasing in size and also in the numbers. So that's why I was worried. I just came to Dr. Jadhav and he told me, you go to that homeopath, will definitely going to help you out because steroids is not going to help in this condition. As you know that other modern medicine is to give only steroidal treatment or some kind of antihistaminic remedies for the same. So already he knows my results already. He has his experience of my clinical practice. So he told, go there. Dr. Pente definitely going to help you out from this condition. But what is the most important challenge? When any allopath send you the case and you have to prove yourself, you have to give result at anyhow in any kind of a case. So I said, okay, let's deal with this case. So a very small girl. I said, okay, let's go. So I told her, let me know something about what happened, from when we start, how it starts. So her mother told me, doctor, we went to a village. We was there at village, and it was a weekend, Friday, Saturday, Sunday. So we went to their native place, and there was a joint family, and their brother and sister decided to go at a river side for a bath or for the swimming, and they was there for most of the half of the day. They enjoyed a lot in the river, and that was it was a rainy day, so it was a muddy water. It was the full rain, full river was there, full rain was also there, so it was the condition. So doctor, they played a lot till afternoon, and in the evening she developed a high grade fever. Okay, she was crying all the time because of she complaining severe burning pain around the buttocks, but that time there was no as such eruptions. But later on, after 2 to 3 hours, there was a small eruptions arises on the buttocks, and there was itchy part, there was itching and severe burning pain was there. I said, okay, tell me something about it. I was just trying to understand the journey of the disease. I was trying to understand the process of disease, how it develops. Okay, so be careful. You have to solve the case. Keep the remedy with you if you have. Okay, today I am not going to tell you the name of remedy. So be attentive and be with me. Are you there? I hope so. So what about the eruptions and her pain? So I asked her, what happened, beta? Beta means, so what happened, dear? My dear, kind of. So she told me, doctor, there is severe burning pain on my buttocks. There was also itching. If I touches the eruption or the itching, again the pain starts. I just cannot tolerate the touch. Okay, I just cannot tolerate the touch of my frock. I just cannot tolerate the touch of my undergarments. And mother wanted to go me to school. How can I go, doctor? Tell me. It was so pain. So as I always used to go for clinical examination, I never let my patient to without examining it, though it is also followed. So I told her, show me where is the eruption, and she started crying. There was a tears in her eyes. I said, what happened? No, doctor, there is so much pain. I said, okay, beta, just let me know. I have to examine. Just show me it. Where is the eruptions? Where is the pain? So I told her to get bent down. She bent down like this, and on the buttocks there was eruptions. Then what I noticed, while getting up erect or while getting up standing position, she started crying again. I asked her what happened. She told doctor there is so much severe pain. It's so dry, it's so crusty eruption, doctor. And if I change my position, if if I'm going to get the bed going to get erect or going to get stand up, there is a severe pain. So that was the condition. What is in the case? Again this burning, again the burning, again the burning, which was aggravated by touch, aggravated by emotion, aggravated by slightest touch by claws and all these things. This was going on. I said, okay, tell me something more about it. So on clinical examination, she was completely in fever, 102 fever. I told her to bend down, but again there was a severe pain. Okay, I asked her, "Kya hota idhar? What is happening there? Why there is so much pain? What is happening at the region of eruptions, at the local area of that eruptions, at the local area of that buttocks?" She told me, doctor, as if no, ऐसा लगता है यहाँ किसी ने पकड़ लिया है वहां पे. डॉक्टर से किसी ने पकड़ लिया वहां पे. What it means, as if someone caught there, someone hold that area. Now I am not able to move. It's completely stiff. Okay, it's completely painful moment for me, as if someone hold tightly there at that eruptions area, at that buttocks area. That was her words. पकड़ लिया है वहां पे. ये उसके words थे, ये उसके इसका wordings था. जो है वो जो fact था वो बता रहा हूं आपको. I said okay. And what I observed into the aggravation, there was aggression by touch, aggression by slightest movement, aggression by walking, aggression by claws. What is the most important point? We can say her mother told me, doctor, what I did know, it was a rainy day. Okay, before one day they was like into the river, they enjoyed a lot. But on the next day, when I used a warm water for bathing, she felt it was feeling better. Then I started washing it, that eruption area, again and again with the warm water. She told she felt better with washing by the warm water. That was the condition. That was the modality. That is a peculiar modality. So I said, okay, let me know something more about it. Okay. So what I am going to tell you, whatever is the case, observation plays one of the most important part in any kind of a dealing with a pathological case. If you are going to visit ICU, if you are going to visit an ICU, if you are going to visit a patient who is on a last stage, okay, if you are going to visit a person who is at the home, he might be on oxygen, he might be on hypomass, he might be on Ryle's tube, or he might be not completely conscious, but you have to be a keen observer. I should tell you have to develop that clinical eye. One of my mentor, one of my guru from Calcutta, he always told in his lecture, you have to develop your clinical eye. Okay, once you develop your clinical eye, half of the things done well for prescription. So every homeopath, while dealing with the case, or in your clinical practice, or in your cabin, or whenever you are going to visit, you have to always keep your antennas alert. You have to keep your all five senses alert: hearing, taste, smell, touch, sight. You have to understand, is there any smell to this eruption, as we have seen in the last case of arsenic case. It was not there in the case of causticum, right? So these are the things which is very, very important to understand. So in this case, on observation, you can see that the eruptions are dry, scaly, and somehow moist. I am telling you, somehow moist. There is no debris, there is no pus formation, there is not oozing pus, there is no kind of oozing eruptions like Dalkamara, there is no greenish discharge like Marsol, there is no pus formation like Silica, there is no kind of other eruptions like hyacinths. It's completely dry, and you can see it's a white patches. It's a dry white patches and somehow moist, somewhere moist. This is the beauty of having a clinical life. On this point also, you can enter the case. On this point also, you can give the exact remedy to the patient, right? So let's go ahead. I hope you are ready to type the rubrics in your repertoire chart. Go ahead, keep doing, right? So let me know the etiology, let me know the modality, let me know the observation, your observation in the mentals. What I observed in the case was she was not able to bend forward. If she bent forward, there was a severe pain on getting erect. What is the sensation in the method? What is the process or the journey of the disease? Come on fast. Type in the chat box. I am asking the etiology, you are telling me the remedy. मैं पूछ रहा हूँ जाना कहाँ है, आप बोल रहे हो जाना था जापान और पहुंच रहे लंदन, ऐसा मत करो. I'm asking, we have to follow the process, man. Yes, modality, getting wet, absolutely, Dr. Siddeshwar. It is a etiology, getting wet. Sea bathing, no, it was a river bathing, Dr. Minakshi. Very good, Dr. Asif. Almonds from getting wet. Absolutely right. Etiology by playing in the river. Absolutely. Etiology is so find out take that rubric, right? Take that rubric. Then what is the modality? The modality absolutely warm application because of washing by warm application, right? Aggression by motion by Dr. Sridhar. Absolutely right. Go more deeper to that. What is the observation? Now you all are on the track. I'm feeling happy that I feel that now I'm able to connect you. I'm able to convince you how to go in the case. Somebody, yes, Dr. Nyanada pakad liya hai. Caught as if exactly this is the sensation. Exactly, Dr. Nyanada. Superb sensation. Severe burning pain. Yes, severe burning pain was there. Aggression by touch, aggression by cloth, aggression by standing. Yes. So, my dear friend, today I am going to share you one important point. Now what happened? No, yes, Dr. Neha said absolutely right. Dr. Neha said caught unable to move. Absolutely. Yes. So I'm going to tell you how to go for rubrics, how to go for this eruptions, rainy weather, pain bending forward. Definitely, this is the exact we can say now aggravation according to the season. Because of as per the season, it's in the rainy weather. Super. So today I am going to tell you something. Yes, Dr. Puneet, movement restricted. Absolutely right. Movement was restricted because of pain. So today I am going to tell you, I am going to teach you one of the most important point today, which was not covered in last 2 webinars. So now what you did, you shared your understanding with me. Somebody feels like it's a burning pain, some said it's aggression by bathing, some said it's a it's a cord sensation, some said it's the restriction movement, some said it's because of rainy weather, eruption in the rainy weather. But my dear friends, what we need to do, listen carefully, okay? Rather than directly jumping on the remedy, always have a faith in process. Always have a faith in process while taking the case on your laptop, on writing the case paper. On the right side of your your case paper, follow the steps: first, second, third, fourth, fifth, because patient will not tell you in the symptoms into the sequence wise. He will tell you, he will jump from here to there, but you have to understand what is the process. So what is important in this case, you have to understand the process, how it start, when it start, how did eruption start, when there was a fever was before the eruptions or after the eruptions, how the modality brings out, how the mother understand it was because of hot because of washing by hot water. So you have to understand the process. Whenever you end the case, be in a calm way, go back down and understand the process of, it can be a long case, it can be an acute case, or it can be a short case, or it can be a pathological case, it can be an ICU case. You have to understand the process. My dear friend, destination is not important, remedy is not important. It will definitely going to help you out, but once you understand the process, when it start, how it's going, when this eruptions develops, then your confidence reaches up to 1000%. You will be damn sure confident about your solution of remedy. You will be damn sure about your destination. I am following the process. I know the journey of disease, and I know what to take, what not to take. This is very important. You can follow the process in any case. It can be a psychological case, it can be a pediatric case, it can be an acute case, it can be a pathological case, it can be a cancer case. While following the process, you will get the PQRS. You will get the most uncommon symptom. You will get the most singular, peculiar modality. You will get the most, important fear, important dreams, or the sensation. Are you with me? I'm able to connect you. I hope so. You are there. Hello, good morning. I hope so. You are there. So always go with the process. And how to take the rubrics? According to the process, you have to take the rubric. Never jump directly by taking the rubrics by here and there. Somebody feels it's a cord sensation, so I'm going to take a rubric. No. Start, understand the process. What was the etiology? Because of river bathing. How it happens? After river bathing, there was a fever. After fever, she complained the burning. Then eruptions develops. And then there was a severe pain. Then modality of aggression by touch, aggression by movement, aggression by changing position. Are you with me? So this is very important, and then along with this, you can go. And in this portrait of repatriation, or in this portrait of process of the journey, process of the disease, or the journey of the disease, or the course of the disease, you will get one anchor. You will get one of the most important pictures point. On that point, you can rely, you can understand. If you go like this way, you will get a common group of remedies, or you will get a single remedies into the all rubrics. If you follow the process, if you follow the journey, if you follow the course of disease, right? So in this case, what is there? The first of all, she went for a river bathing. It was a rainy days. Then fever develops at the evening. At the evening is very important. Okay, time modality. Then fever goes high grade up to 102, 103, and then the burning and itching start at the area of buttocks. Then eruptions develops, and we know that is the eruptions of herpes. And into that herpes eruption, there is a very singular, peculiar, uncommon modality of emulsion by hot bathing, emulsion by washing by hot water. And her mother noticed that this is spreading all over the buttocks. It's going to spread in numbers and size also. Then they went to allopath, and allopath said us. Allopath referred the case to us. This is the journey. Once you do it again and again and again and again, it will be easy for you. You just driving a car. It's very difficult at the beginning to drive a car, where to see, where not to see, in a middle mirror or a side mirror, or clutch or a gear. But once you do it again and again, in every case, it will be like a cream for you. It will be like a easy for you. And your rate of success increases. You must need to have a reason that why I prescribe this remedy, why I took that rubric, why I select that rubric, because you have a process, you have a journey of a disease, you have etiology, you have everything. Be here, what I'm telling you, my dear friends. Be attentive what I'm telling you. This will not be going to tell you by anyone what I'm teaching you. Okay, this is the artistic way of dealing, pathological cases. This is the artistic way of decoding the acute case or pathological case. So, in our case, there was etiology of taking bath in river. Modality, which was aggression by pain on touch, changing position, touch by cloths. What is the most PQRS? Emulsion by washing warm water. An observation, eruptions are dry, scaly, moist. At mental level, she was weeping, she was crying. Somehow she is also irritable due to pain. Right? And on my clinical examination, what I noticed, it's very difficult to get erect once she bend down. So changing position is difficult for her because of that dry eruptions, because of that dry herpes scaly eruptions. And what was the sensation by told by Dr. Dhyananda? Exactly, pakad leta hai, like a caught sensation. What doctor she told that restricted movement. Exactly, it's a restricted movement. She was not able to move. And all these things we need to consider in a totality, my dear friends. Totality is very important. But what is the entry point in this case? What is the anchor for us in this case? How we enter the case? Here is it. So one of the most important point was the modality forming. So the students who are from first to enter interns, be listen what I'm telling you. This case can be solved with the only modality. We have the exact modality. Eruptions, herpetic. So now here I am not going to take only eruptions. I am going to more particular as per the diagnosis. The diagnosis is herpetic eruptions. The eruptions, emulsion by bathing, washing, hot emulsion. This is the remedy, single remedy. What else? Eruptions, bathing, washing, warm emulsion. So we have considered both herpetic and eruptions because we need to have this remedy in both the rubrics. What else? Herpetic eruptions, fevering. So even on my clinical examination, she had a fever. Okay, the first fever starts, then the herpetic eruptions occurs, and along with the herpetic eruptions, she was in fever. Now see the journey. Now see the process. How is it important? So you have to consider each and every rubric as per the journey of the case. You have to consider each and every rubric as per the course of the disease. So no doubt, a remedy must be from all these four remedies. It can be natrium moor, it can be a carbovage, or it can be rustox. Who knows what is the remedies? I don't know. I'm going to make it easier for you that what is my thought process, excuse me. So my dear friends, whenever I was attending the lectures in other zone, there are so many mentors, but my mind was, very eager to know how that mentor reached to that remedy. If my remedy is right, I was never happy. There are remedies sahi hai, मेरे को खुशी नहीं होती. What I was seeking, what I was searching for that, how that doctor or how that physician reached to that remedy. So the process, the thinking process of that mentor, you should need to understand. The thinking process of that mentor, you need to learn to reach to that remedy. So in this case, this is my PQRS on the modality. Rather than understanding the burning pain, I asked her what kind of burning pain, but she was not able to, told me what was the burning pain. But what was the surest point for me? That burning pain of herpetic eruptions was better by washing hot water, right? So yes, there are few. Tell me the rubrics. Tell me the rubrics. I never go with the remedy. I never with the remedy. Dr. Ruby told warm water. It can be. There are also few remedies. Will tell you. Okay. So here is the rubrics. Another important point. What Dr. Neha told that this eruptions was in a damp wet weather. It was in a rainy days, and you know that why herpes eruptions, because it's an autoimmune disease. It's a viral infection, and that was a muddy water in the river, and because of that. Water that infected water get the infection, viral infection, autoimmune disease, autoimmune problem, herpes is like. So we have 7 remedies. Okay, so also into that we must need to have that remedy which is covered by that rubric. So here is my understanding of rubrics. The diagnosis is herpetic eruptions, etiology is eruptions when getting aggravations. Okay, character of the pain is herpetic eruptions burning, skin eruptions herpetic feverings. Modality is very peculiar and uncommon. Skin herpetic eruptions, bathing, washing, warm emulsion, hot. And also I told you there was a single rubric. Skin eruptions herpetic itching also there along with the burning. What is the observation? Skin herpetic eruptions dry, scaly, crusty, whitish. If you go to the repertory, try to find out the herpetic eruptions, whitey, patchy, you will get the remedy. Okay. So what is the remedy now? Here you have a totality. But I will tell you what is the important part in this case, how it went. Okay. After giving the remedies, I prescribed her remedy on 28th of July, and just after 7 days, that eruptions aggravates. That eruptions coming out. You can see in the picture. In previous picture, there was only on first part on the right side. There was not too much on left side, but now you can see it's completely increased on all the ways on both the buttocks, also in the numbers, also in the in size. So what to do? How to understand the prognosis in this case? It's aggravation or amelioration, or it's on the process of getting cured. Come on, tell me. Come on, come on. It's not about the remedy. I'm asking. Tell me the prognosis. How is it? What to do now? Hello. Are you there? Oh. See generals in follow. Yeah, definitely, Dr. Manisha. Dr. Siddhesha said it's good. Tell me how it's good. Low potency. We will come to the potency. Patel why? As if now let me know it's a good prognosis or a bad prognosis. Sir, it's a homeopathic aggravation. Siddhesha Jadhav. Oh, absolutely right. Dr. Bikapur said it's aggravation. Oh, somebody said we have to go with the intensity, just the intensity in generals, and it's a good sign. Homeopathic aggravation. Oh, homeopathic aggravation. Oh my dear. Oh. Homeopathic aggravation. Herpetic eruptions unilateral only if immunocompositive bilateral. Okay, no, ma'am. You're right. First aggression and then comes ammunition. Better sign. So, my dear Dr. Punit Kumar, you are absolutely right. So, you must need to understand the pathology. Why? To understand the prognosis. So, it's eruptions. Whatever Herring's law says, eruptions should be come out within outward. If we have measles, we don't need to suppress it. If we are going to suppress the herpetic eruptions, if we are going to suppress the herpetic discharge, it will turn to the herpetic neuralgia for a long time. And we have many cases after taking steroids, after taking so many anti-suppressive medicines. So here, what is happening after giving the medicine? Now see the pictures. Be precisely, observe carefully. That crusty things comes out. That crusty things goes away, and now there is a discharge. So mostly herpetic eruptions takes mostly 15 to 18 days or 20 or 3 weeks to get healed. But just after giving medicine in 7 days, that herpes eruptions like oozing, that discharge started oozing. Okay, so that's why to understand what is the importance of prognosis. Here is it. It's not a homeopathic aggravation, my dear friends. It's a good sign. It's as per the Herring's law of cure. If we are giving a medicine for the boil, that boil's pus formation automatically come out. It's not aggravation. The same thing in eruptions. If you are giving the right medicine, that eruptions comes out. We have to have a faith on yourself. You have a faith in your own medicine. But when it happens, when we have a knowledge of pathology, when we have a knowledge of action of your remedy. Okay. So after the medicine, now see here on 13th of August, just after 16 days, everything was okay. There was nothing, no eruptions, no discharge. Okay, and you can see the also date in the picture. I'm not a fake person. I'm showing you the picture, that picture of camera. Okay, so just after 16 days, it's completely gone. Okay, so now again the question, so what is the remedy? What you describe, right? Are you with me? Fever suppression, cotton tea, no cotton tea. Dr. Abhishek Pagare said patient well-being is important. Yes, definitely. In pathology, we need to understand vital symptoms also. So here I'm going to discuss with the remedy. So in this herpetic eruptions, emulsion by bathing, washing hot water is Rastox. And even if you go to the generalized eruptions, which is emulsion by bathing, washing, warm emulsion is also Rastox. And in the herpetic eruptions, in fever, also we have Rastox, right? So now see the beauty. Also, if you try to understand the seasonable modality, a seasonable, causative factor, eruptions, weather, damp, wet, rainy seasons, also there is a Rastox, right? And now, if we go to the repertorial chart to understand what is there in our repertory after taking the totality of all rubrics, we have Rastox. And now, what is the important point? Sensation. Everybody knows that there is a stiff cord sensation, emulsion by hot bathing water, and it's nothing but from the anacardiaceae family. Are you with me? Now, what to do about the main etiology? What to do about the main etiology of by taking a river bath? So, if you go to the reference work and try to understand, here I'm also going to how to use the reference work. So, go to the reference work: herpetic eruptions, rainy damp weather, herpetic eruptions, fever in eruptions, emulsion by washing emulsion. We have single remedy in 20 references. That is nothing but the Rustos. It was given by Allens, right? It was also given in complete repertory. Are you with me? So this is the beauty of knowing the journey of the disease. As per that, we are going to take the totality, and along with the totality, if you go like this way, you will get a fantastic results. This is called a scientific evidence. How we are going scientifically. We are just not going jumping from this rubric to that rubric. So it's not important to know which is important rubric for yourself. So here we are not to understand what is important. Patient will decide which rubric he needs. The journey of disease will decide which rubric we have to take. The journey of the course of the disease will tell us how to follow the rubrics as per the journey of disease, right? And from this, after 16 days, it comes to like this. I hope so you are with me. I am able to connect with you. I am not going to teach you how the remedy. I am going to tell you how to follow the process, how to take the rubrics, how to take the totality, how to enter the case. So our anchor in this case was just the modality. I have never seen a case of eruptions, herpetic eruptions. I have never seen a burning pain which was emulsion by hot water. Most of the cases, they get emulsion by cold water, cold applications. It was completely controversial. It's not completely opposite of that, right? But it's given in Rustos, it's given in Pathological, it's given in Bori. If you also try to open the repertory, herpetic eruptions, crusty white, you will get Rustos. Herpetic, fever, aggression, evening, 6 p.m. or rising, you will get Rustos. But we need to understand, we should need to know that which rubric is important in which case. In pathological case, you have to give more importance to the pathological rubric. Are you with me? Yeah. So what is here? In these 3 free webinars, we have learned this. In these 3 webinars, we have learned listen and observe. We have to consider the factual things. It's there in chip complaint. First 10 minutes is very important. Just go investigate each and every word of the patient. Don't use your mind. Don't be prejudiced. Don't be interrupt. After that, we have one of the most beautiful case by Dr. Manish Yadav. And also wanted to tell you, you have given their feedback form. Fill it, and also let me know what you want to learn in next few lectures. So in these few courses, what is important? Etiology, causative factor, diagnosis, modality, sensation. We learned today sensation. How that sensation confirm also remedy from the Rustos, not the sulfur, not the leadum, not the myrrh, not the sepia, not the bovista, not the arsenic. Somebody told the arsenic. But from this sensation of caught stiff emulsion by hot water, it's a completely opposite polarity in the modality. And also, these eruptions started from the right side. Rustos belong to the right-sided remedy, more on the right side. See here, and then it develops to the left side. So this is very important to understand this course, modality, current mental state of the patient, states minimum. From the current mental state of this patient, we can understand the posology, doses. I have given these patients Rustos 200 BD for 7 days and then stop the remedy. Then all eruptions come out and then there was no any single dose to that patient. All things were done by the process of medicine, healing process, curing process of that medicine. Also try to understand the sensation at physical level. You must need to get that sensation at also mental level, also at the system level. And this synergy helps you to select the remedy. This synergy of all these things, all this totality helps you to select the exact simillimum, exact medicine, and you will get the most, confidence while giving the medicine. Okay. Then portrait of acute condition or portrait of pathological totality. This is also an important overview of the case and try to understand what is anchor, what is PQRS, what is the most important point. Take the totality, or you can separate the totality of mental, pathology, diagnosis, modality, observation. You will get group of remedies, or you will get the exact remedy, right? See, giving results in a short time is not an easy work. You have to do hard work, my dear friends. Invest in yourself. Invest in learnings. Invest in attending lectures. Invest in attending sessions from different mentors. Everybody having a different thought process to reach the remedy. But you have to invest yourself. Invest your time. Invest your money. Invest your energy. Only and only for learning. Right? So, here we have a case by Dr. Manish Yadav. It's 7:47. We have to finish lecture at 8 p.m. It's 1 hour session. So here I am going to share Dr. Manish Yadav case. It's very important case, very beautiful case. He's going to share you his knowledge. Be careful and listen him. So IT, I will come to all the questions at the end of session. Don't worry. Today I am going to address your all questions at the end of session. Let's finish the case of Dr. Manish first. Then we'll get back to you. So, IT, are you there?
Yes, doctor.
Yeah, so let me know if sound is there or not.
Hello everyone, my name is Dr. Manish Yadav and I'm here to share with you a tip regarding solving pathological and challenging cases.
IT sound
Solving pathological and challenging cases actually requires
sound hai?
Yes,
Hello,
doctor.
IT? Yeah, fine.
Different acumen. I will say
Listen
a specialized acumen to understand the patient, the disease, and to give relief. Let me share you a tip or a case. I'll share you a case from a very recent one, from a very recent example. In my cancer OPD, a patient came to me. This is just 1 month, just 1 month follow-up. Patient came to me and she was having CA breast, right-sided CA breast. She was already scheduled for chemotherapy in Tata. They came to us and she wanted some treatment for immunity building, XYZ, like that. So she heard that homeopathy can help in cancer sometime. She came to me and I put a lot of my efforts from local to general, mentals to the totality, as every diligent homeopath will do, worked really hard. And I was very happy because I came to a remedy which I was very confident of. I came to a remedy called Apis mellifica. A lot of things written in Mater Medica were matching with this patient. I was really happy, but I was also knowing that just maybe 15-20 days later, she will be going for chemotherapy. And now you can't stop the patient, right? It is their decision. They already had decided that they will be doing chemotherapy, but they came to us. And I said, let me see what best we can do. So I gave Apis 1M and 10M. After giving Apis, 15 days follow-up which happened, patient was very happy. Why? Because a lot of general symptoms improved. Her pain gone, the swelling gone, constipation which was there for ages improved. And as Kent always talks about, especially in his lesser writings, that when generals of the patient improves, you know that you are on the right track. And I was very happy because I could see the changes that are happening. So maybe if she would have stopped, I could have helped her and there was no need for chemotherapy. But yes, she was already scheduled, and in the pressure of family members and of course herself also, she went ahead for chemotherapy. So I told her, whatever your decision is, be in touch with me. If anything happens, I'm there. She goes for chemotherapy and she does not give me a call. I also forgot, I got busy with other patients. After taking chemotherapy, there was severe side effects, severe. Gastritis came in, fever came in, nausea, vomiting, all the symptoms of chemotherapy side effects came in. And she was given all the allopathic medications like, paracetamol, antiemetics, painkillers, everything was given. She was taking. But her vomiting was not stopping. Her diarrhea was not stopping. 3 to 4 days passed. She had become very weak. As you know, a lot of vital fluids are lost. She has not ate anything. There were a lot of aches and pains. Her condition was terrible. And in that state, on the fourth day, she came to me. And looking at her, I was also a little apprehensive. Why? Because her vitals were not that great. I was thinking maybe if this continues for 1 or 2 days more, maybe she needs administration. Hospital administration is needed for this patient because nothing was helping her. So diligently, what I did is that I took the case. I took the case as you take it, the totality, and asked all the acute symptoms. And not to my surprise, there were few remedies that pop in. And these remedies were basically one of the remedies called arsenic, Lux formica, colchicum. These are the acute remedies. Usually you get it when there is a chemo side effects and gastritis and other symptoms set in. And after differentiating few remedies, I came to a point that, okay, maybe I should give her arsenic and then see what happens, because arsenic was covering a lot of symptoms. Her condition was so bad that even a sip, she wanted sips of water, but even sips used to cause a lot of gagging and nausea and vomiting. So I decided maybe Herpes, I could repeat the Herpes, the same remedy, the indicated one, but I decided not to repeat Herpes because Herpes totality in acute, Herpes totality was not matching. And it was more pointing towards arsenic, probably Nux vomica and colchicum, but arsenic was looking very close. And then, of course, generals, you all know that even in pathological cases, the generals has to be understood properly. You have to go from generals to particulars, not particulars to generals. Generals are the symptoms on which your mater medica, your remedy has to be decided. So when I was eliciting her general symptoms, I found out that she had a peculiar taste in her mouth. And the patient used to say that she should like this. I said, why are you doing this like this? She said, my mouth is very salty.
Listen carefully.
It is very salty.
Important point.
I said, salty? Yeah, the saliva is salty, the taste is salty, the food I eat salty, everything is very salty.
That is the entry point.
And then I said, my God, I have handled so many pathological acutes, but this is something different. Salty taste is okay. You get it in some patient, but it was an increased intensity. So it is said that if it is an increased intensity, like in patient, a symptom is there, which you want to prescribe, and it is 3 marks.
Very important.
So the remedy that you're choosing, in that remedy also that symptom should be 3 marks. But arsenic doesn't have. It might be having that symptom in repertory, but not in that great intensity. So much saltiness, so much saltiness. How did this symptom develop? So my favorite notebook, my favorite workbook, Allen's Keynote. Whenever I'm in doubt or I want to give any remedy, I always read Boric and Allen's. I opened Allen's and I started reading Herpes. Why Herpes? Because I was very confident that Herpes had really helped her. Her journals had improved. I was very confident about because how do you know the remedy has acted? The follow-up decides the remedy has acted or not. Patient used to say that, why don't you give me the first remedy because it has helped me so much.
Yes.
And when I was reading Herpes, you can open Herpes in Allen's Keynote and you go down, down, down. In relationship, you'll find out complementary remedy, Natrum muriaticum is written. Natrum muriaticum and salty taste. And of course, when I looked into the repertory sheet, there was Natrum mur somewhere. Now I'm thinking, what should I do? Should I give arsenic or should I give Natrum muriaticum? And just to check, I said, let me check, because arsenic is very commonly given. As the drug causes side effects of gastritis and everything, there are bound to happen that arsenic and colchicum, nux vomica, ipecac symptoms are very common symptoms also in this acutes of pathological cases, especially after chemotherapy. Nux vomica also one of the remedies. And just on that basis, and the salty taste and complementary, and I was so confident about Herpes, I said, let me try natrimuraticum. Gave natrimuraticum at 1 o'clock in the afternoon. Every 3 hours, I was in touch. 1 m in water dilution every 2 hourly I gave. She gave me a call in evening 6 o'clock. 30% she was better.
Right.
At least she could sit down and talk. Okay.
Vitality improves.
10 o'clock again, I had a call. Around more 20-30% she was better. Around 50% she was better. And in the morning, again 10 or 11 o'clock, we had a call. She slept properly. Her pains, her aches, nausea, vomiting, all the discomfort went off. She slept. She had not eaten for days, for 3-4 days. She ate some, soft food like bread, butter, and jam, and something like that. Okay, khichdi. She ate some soft, solid foods, and her complaint completely abolished.
Right.
Isn't that interesting?
Interesting.
That's why I said that understanding and dealing with pathological cases is not that simple, but yes, it is achievable. If you liked what I shared right now, you have a great chance to come to us. 5 clinicians coming together under the banner of Toshi. We are going to talk about our clinical experiences. How do we handle difficult, challenging cases in our clinics? We get a lot of difficult, challenging cases. Our practice is almost, flooded with difficult cases, right? How do you manage it? What is the thinking process? And the best part is all the 5 physicians or clinicians who are coming towards you to teach you pathological cases have a different background, different mentors and teachers. So in one session, means a series of sessions, in one module, you can get experience from different people, and you can add to the acumen that you are trying to achieve. You can add one more quality of handling these kinds of cases. So in that way, we are going to go ahead. The good news is that we have started a free session before we start our course. And this free session is basically for people who are, especially who are serious people, to give them a glimpse of exactly what we are going to do. So on 13 March, you should not miss it. 13 March, we have a session by one of our speakers.
Hello. Yes. Am I audible, Andy? Yeah. Am I audible?
Yes, doctor.
Yes. So now see, what is the beauty of prescription? How Dr. Manish went to do just very peculiar symptom of salty taste in the mouth. And from Herpes mellifica, it's given in the Allen's note or body into the complementary. It's given Nitramur is also complementary remedy to the Herpes mellifica, and it gives a fantastic results. So in pathology, each and everything is important. You just cannot consider most important point, but you cannot skip the least important point also. It can be a PQR, it can be an important point, right? So we are coming all 5 great clinicians. Dr. Ranjana is from Varud. He has done his PG from Calcutta. Dr. Abhishek Joshi is from Dr. Farooq Master's Clinic. Dr. Manish Yadav is one of the, he's practicing more than a decade dealing with cancer cases specific. Dr. Manish Uppal practicing in Punjab, and we are coming with very, minimum charges. We are coming with a 200 per session at least, just a minimum charges. So I would love to tell you, just invest in yourself. So don't eat pizza and burger for next 1 month. Don't go for a movie. Okay, don't buy anything important for you, whatever. Just invest in yourself, and what you will learn in this series. In this series from 10th April to 8th May, what you will learn, I will be also there in each session. I will also sharing my ICU cases. I will sharing my comatose cases, pediatric cases, pneumonia cases, meningitis cases, atrophy of brain cases. Okay, what I taught you in this free webinars, the process, how I enter the case, what are the important points from which we can consider the totality, that I taught you. So in these coming sessions here, we are going to tell you how to manage the ICU cases, cancer cases, comatose cases, gangrene cases, how to use the repertory in pathological cases, what are the important repertories, what are the differential points given in Mater Medica, what are the clinical Mater Medica which you can use to finalize the remedy, right? Then how to give the doses, where to give single dose, where to give water dose, where to repeat, where not to repeat. If patient is in coma, if he is into the, if he's done his tracheostomy, or he's on tracheal tube, or he is on ventilator, from which source you can give the remedy, how to repeat in this condition, how to understand the prognosis, how to understand the vitality, the generals. And in this session, I will be there for you. In each session, I will help you out. I'm going to give the attention on each and every participant, in each student, or in each doctor. And this will be only for 1.5 hour session. We will provide you the recordings also. We will also give certificate. Okay. So be there. I hope so. Be there. So having a free knowledge is also important, but definitely if you are going to enroll this course, I will tell you, you will learn a lot from different mentors. And all these are the young buddies. They are a raw physician, they are a raw clinician, they will share your knowledge, right? So now it's a question and answer session. Yeah. Yes, grade 3. Dr. Radhika asks, sir, narrate the criteria for potency you select. Dr. Puneet, I gave her Rusters 200 BD for 7 days only. And Mrs. Good has done my treatment allopathy. Okay. Anybody have a question, you can ask me. Dr. Neha asked potency. I told you the potency repetition. Sound hai. Yeah. Dr. Kausar said, will the recording be available afterwards? For these sessions, it's not possible. For the session, we are going to start course on 10th of April. We will provide you 72 hours recordings for 72 hours, right? So here I would like to introduce someone at least who can conclude the session. Dr. Maja is there. Dr. Maja. Dr. Elri Malingping, please unmute yourself. Please experience your words by attending this session. Dr. Elri, IT, unmute her or unmute him. Hello, am I audible? Dr. Neha, am I audible? Dr. Ardi, am I audible?
Yes. Access provided from my end. She needs to unmute herself.
Unmute yourself, Elri. Unmute yourself. So Dr. Puneet, you will get all the answers once you will be, enroll the session. We will definitely love to give your answer. So what tomorrow for recording is less, please give me more time for the recordings. Okay. If medicine is, if your medicine is correct, it will going to start act in 0.08 seconds. You must need to have only right medicine. That's it. But for that, you have to understand the process. There are so many different cancers. The line of treatment will be different as per the case, not as per the physician. The doctor, the case will tell you which approach, repetition, doses he need or she need. Anyone else who want to share their experience? Fine. You have different. Asif, you have thousands of books to use. You have thousands of references books to read. You can take anything, no problem. Dr. Smita Mahajan, very good evening from Canada. Can you conclude the session? I hope you can share your experience for this session. Elri, ask Elri to unmute, or Dr. Smita Mahajan from Canada, you can unmute her ID. Dr. Smita, you can unmute yourself. Is it possible to unmute her?
Yes, doctor.
IT?
Yes, access provided.
Dr. Smita, you have to unmute yourself. Just have a few words with us about your experience by attending this session. Yes. Yes, Dr. Puneet, you have to consider cardiac emergencies not only as MI. There are so many cardiac emergencies. It can be CCF, it can be a COPD, it can be a cardiac arrest, it can be an angina, or it can be MI. Okay, but there are so many different things into this. Yes, Dr. Smita, if you are there, you can conclude the session, please. I would love to invite you. Okay, Dr. Nyanada, are you there? Dr. Nyanada Ganikar, have a word with us from your side. Share something. Yes.
So thank you, Dr. Pravin and Dr. Manish, for such a wonderful session, because the remedy is not important, I guess. It is important, but the way and process to reach the remedy step by step is very interesting and is very important to know. So this is what I've gained in this session. And the smartness and the five senses with which Dr. Pravin approaches the case is just phenomenal. Like, it's मतलब कुछ बात ही अलग है, because we need to just we just need to enter the case to that point, and then the whole case reopens very beautifully. And it's such a wonderful art. And then when it's combined with the science, like the materia medica and the repertory, it is just like phenomenal. No words. I'm very grateful and very thank you. Thank you, sir.
Yes, sir. Thank you.
Thank you.
Elri Mellingap, I don't know how to pronounce her.
Dr. Pravin, I'd like to share something.
Yes, sir, sure, why not? It's our pleasure to share your knowledge with us and experience. Sure, sir, go ahead.
I think the way you presented the case is superb, in fact, and is very especially important for young physicians, young homeopaths, to actually understand the whole process rather than jumping to just finding the keynote and trying to work out. Because people who work on keynotes, especially the Calcutta method, are people who have seen thousands of cases. Dr. Sarkar and all, they have seen thousands and thousands of cases, that their clinical eye has developed to a point where they no longer need to repertorize, perhaps. But when we are starting, we need to actually get to that point. Maybe after 10 years of 20 years of practice, we will be like them, where we don't have to repertorize. We have to just look and prescribe. That is one point. The other thing is, like, if you have seen, my observation was that when the herpes spread over to the other buttock, and so there was a sense of panic in the group, in the sense that many people started saying that's a homeopathic aggravation. So this panic comes in because of we need to work more on the pathophysiology, understand how the disease progresses, what happens, and whether it is a curative process or not a curative process. So this knowledge is which is very, very important to build up confidence in treating cases.
Yes, sir.
So I think this is a very fantastic opportunity for everyone, that for just a small amount they are getting 5 sessions, understanding the approach of 5 different physicians, and we all should take benefit of this. Yeah, thank you.
Yes, yes, definitely. Thank you so much for your feedback. Victoria is there. Victoria, welcome. Can you share your experience? IT, can you unmute Victoria? I think she's from England. She was also there in last session. Welcome, Victoria. I hope so. You loved the session. You loved this approach. Can you unmute yourself? IT?
Yes, access provided, doctor.
Yes, Victoria, you can unmute yourself. We would love to hear from your side, from your desk. Yeah, fine. So it's okay, and thank you so much for joining this session. It was our last webinar, free webinar, and from 10th of April, on the birthday of our master, Dr. Heinemann, we are starting our this course on a comprehensive course on art of decoding pathological cases in homeopathy. I will tell you this course will be one of the best course, because these all 4 mentors are like a gem in homeopathy. They are young buddies and they have they have practiced like 70 to 80 patients per day, and they are dealing with all kinds of pathology, gangrene, coma, conjunctivitis, we can say meningitis, convulsions, epilepsy, stenosis of urethra, urethral strictures. They have cancer of kidney, abscess in the kidneys. These are the different deep-seated pathological diseases are there, and you will, helps to learn all the unique things from all of them. Fine. So thank you so much again for joining our 3rd webinar. I hope so. We will take the benefit of this, and I hope so. We have to end the session.